African countries have made significant efforts in accelerating positive responses to the challenges surrounding young people's sexual and reproductive health and rights. And although there is some progress made in providing access to SRHR, there is a growing evidence that at least 10 million unintended pregnancies occur each year among adolescent girls aged 15 to 19. And while adolescent childbearing is declining in most regions, it remains high in Africa. Lesotho is no exception in this. And the prevailing situation has been worsened by the COVID-19 pandemic, which has drastically affected the availability and access of SRHR services to adolescents and young people. The question still remains, why are African countries, Lesotho in particular, still falling short of what is expected of them by the international community despite their commitments? Through the generous funding from Sweden, SAfAIDS is implementing social accountability monitoring for sexual and reproductive health and rights model across the 6 African countries, Lesotho included. Through this model, SAfAIDS seeks to strengthen the capacity of young people and youth networks for the improvement of youth-friendly SRHR services. At the core of this model is the MobiSAfAIDS application, which enables real-time reporting and capacity of service delivery issues that are raised by the adolescents and young people. SAfAIDS Lesotho implements this model at the Maputo Filter Clinic in the Leribe district. At the forefront of this initiative has been the trained social accountability monitoring champions who have been cascading SRH information to the community, assisting young people in registering and using MobiSAfAIDS, as well as assisting them in accessing SRHR services. The SAM champions have been working collaboratively with healthcare providers at Maputo Filter Clinic in order to ensure satisfactory SRHR service delivery for young people.
This model is very valuable to the facility since its inception in this facility. It helped us a lot because I can say it was used as the monitoring tool for the facility. We managed to increase the number of patients who come here for SRH services. It also helped us to improve staff attitudes, as we know that the client can complain if they didn't get the satisfied service, as well as it helped us a lot because we managed to resolve patients' complaints as soon as possible as compared to the previous tool that we used, the suggestion box, because it was a one-way feedback, of which this model is a two-way feedback because the patients lodge the complaint and we also go back to the client to resolve the problem.
The social accountability monitoring for SRH has helped so much because our adolescents and young people are registering. And it seems our numbers are increasing lately. They are opening tickets, that is the issues they come across at the clinic. And those issues are being attended to. That means something is being done. That means change will be done. Yes.
We did have represented from the council city. They know about it. That's why even the other councillors from other ADs, they were so like in need of it. How can we, in us, can be part of this model? Not only filter clinic, but even within the community. Can we have access to this? And it was like, you know, the same champ. If you want to know how can we work with this model, you can go to same champ and the same champ can guide you.
Since the invention of MobiSAfAIDS model, we are now being able to express our issues. So that means our issues are now being resolved, of course. So it keeps, for young people, to come more and more and more and more to the facility.
The aim of this model is to transform lives of adolescents and young people. So SAM4SRHR model has created a platform that seeks to involve adolescents and young people in decision making. At the same time, while at that point, providing directions towards SRH issues that should be prioritized in order to bring about policy development and interventions.
The SAM4SRHR model seems to be a very effective model as per the evidence of healthcare workers at the MobiSAfAIDS clinic, as well as adolescent and young people that are using the model. One, before the inception of this model, at the MobiSAfAIDS clinic, at the youth-friendly corner where SRHR services were provided, services were provided at odd hours or at certain times. But since the inception of this model, the services are provided throughout the week and sometimes even weekends through the demands of services by young people. The Ministry of Health, through government, or we can say the government through the Ministry of Health, seems to like this model. They are saying it's the best model ever and it's a reliable model. You can't cheat. Evidence that is generated through this model is reliable because you can't tamper with the system at any time. So they really like this model. Even other partners, honestly, they feel like this model is a good model. And as SAfAIDS, we are really happy to see that the model has brought some change in that community where it was piloted. And we really thank Sweden for funding this model, because it is through that generosity that we're able to get funding to pilot this model that seems to be the answer to so many questions, or the answer to so many problems that young people were facing in accessing SRHR services in Lesotho.